now, if that's okay. Right, so welcome everybody to the meeting of the South West London Integrated Care Partnership. As you know, I am not usually the chair of the Integrated Care Partnership. Unfortunately, Ruth isn't very well and she can't actually be here tonight, and she's asked me to stand in for her, which I have agreed to do. She will be listening online, so Ruth, I know, is very interested in what we're doing, and she really would have liked to be here with us, but unfortunately couldn't come out today. So a reminder just for you, I've got a few sort of pieces of business up front, that this meeting is being recorded and broadcast live. The recording will be uploaded onto the ICS website after the meeting. There will be a version with British Sign Language that will be available after the meeting when we have produced and uploaded the whole meeting. Can you make sure that you use your microphone? So if you just push the button with the little speaker on, and could you turn it off when you have finished speaking, please? There is a hearing loop available if anybody needs it. If you just indicate, someone will come and help you. We will do our best to avoid jargon and acronyms, but there is a glossary of terms available on the website, and if any member of the public would like a copy, please let the member of the team know and they will let you have that. Questions from members of the public will be taken at the end of the meeting. Any questions that we received in writing before the meeting will be prioritised, and if time allows, we will then take questions from other members of the public. Presenters have been asked to treat the presentations and papers as read, and they will highlight main points to the partnership in their presentations. Is everyone okay with that? Yes. Okay, so apologies today from Ruth Dombey, the chair, Carol Cole, vice chair of Central London Community Health, Douglas Flint, chair of Royal Marsden, Joe Farrer, who's the Richmond Place representative, and Ian Thomas, chief executive of Kingston Borough Council. And with no further apologies, although we may have other people joining us, we are quorate. Declarations of interest. You are asked to declare any interests now that are not already on the register, and any interest that you may have on particular items on the agenda. Is there anybody on the... Yes.
Sarah, thank you. Brenda Scanlon from Age UK in Croydon. Although I have sent in my form, because there is a paper on the Innovation Fund, I'll just say that obviously that has implications for Age UK in Croydon. So
thank you very much. We will make sure that's noted. And then I will just, before we go into the minutes, I thought it would be helpful for us to do some introductions around the room, even though we have got the nameplates, because we have got some new members as well. So having done all the sort of preamble, I will go around and do the formal introduction. So as I said, I'm Sarah Blow. I am Chief Executive Officer of the ICB and Health Member for the ICS.
I'm Karen Broughton. I'm Deputy Chief Exec of the ICB and Director of Transformation and People for the ICB.
I'm John Byrne, the Executive Medical Director for the ICB.
I'm Dino Pardinani, Sutton GP and Sutton Place Partnership Convener and Place Representative.
Hello, I'm Annette McPartland. I'm the Corporate Director for Adult Social Care, and I'm the rep here for the DASs in South West London.
Hello, I'm Councillor Piers Allen. I'm Chair of the Richmond Health and Wellbeing Board and also the Place Convener for Richmond Place-Based Partnership.
Brenda Scanlon, Age UK in Croydon. Thank you.
Councillor Yvette Hopley. I'm the Cabinet Member for Health and Adult Social Care and Chair of the Health and Wellbeing Board in Croydon.
I'm Sam Mason. I'm the Health and Care Lead in the South London Partnership, and I'm here to present the item on the Social Care Workforce Strategy.
Hi, I'm Maureen Glover. I'm here to provide admin support for the meeting.
Charlotte Gorn, Exec Director for Partnership Engagement and Communities for the South West London ICS.
Alyssa Chase-Vilches, representative of the 6 local health watches based in South West London.
I'm Carolyn Dwyer. I'm Strategic Director of Development, Growth and Regeneration at Sutton Council, representing all 6 boroughs for economic development.
Good afternoon, I'm Iona Liddington. I'm Director of Public Health at Kingston Council and Kingston Place Convener, and I'm here representing the DCPH in South West London.
Hi, I was going to say good evening, but I suppose it's still afternoon, it's just it's very dark. I'm Councillor Graham Henderson. I'm the Cabinet Member for Adult Care and Health in Wandsworth and also Chair of the Health and Wellbeing Board. Thanks.
Good evening, my name is Shannon Coutinho. I'm the Director of Public Health for the London Boroughs of Richmond upon Thames and Wandsworth. I'm here representing Wandsworth Place Committee.
Hi folks, I'm Sukhvinder. I'm Chair in Common at Kingston Hospital and Hounslow and Richmond Community Health Trust. Thanks.
Hello, I'm Peter McCabe. I'm the Cabinet Member for Health, Social Care, Adult Social Care and Public Health in Merton, and I'm also Chair of the Health and Wellbeing Board.
Hello everyone, I'm Nicola Jones. I'm the Primary Care Services Member of the Integrated Care Board.
Good evening everyone, I'm Anne Beasley. I am Chair of South West London and St George's Mental Health Trust.
Good evening everyone, my name is Gloria Rowland and I'm the Chief Nursing Officer for South West London ICS.
Hello everyone, I am Helen Jameson. I am the Chief Finance Officer for the ICP.
Good evening everybody, I'm Gillian Norton. I chair St George's and Epsom St Helier Trusts.
Thank you very much, everyone, and welcome particularly to new members of the partnership. First of all, I just need to formally get your sign-off of the previous minutes, which are attached to your papers. Can you confirm that this is an accurate reflection of the meeting that we had? Iona.
Just as I was at the last meeting, so if I could just be added to the attendees, please, Sarah. Thanks.
Thank you for that. We'll make sure that happens, Iona. That's fine. I think we've got sign-off of that. I'm now going to hand over to Karen, Andrew, Dimitriadis and Charlotte, who are going to present on shaping our integrated care partnership priorities, a partnership discussion document.
Thank you. In your papers there is obviously a discussion document that we have put there, but I've also given on your packs, or on your seats really, a summary of that in the form of a presentation. So I'm just going to take you through the presentation, but obviously hopefully you've had a chance to read the discussion document. Would you mind going on one slide, please? Thank you. So, as board members will know, the Integrated Care Partnership is required to produce an initial integrated care strategy to set out the direction for health and social care, or health and care rather, in South West London, so for the whole of the geographical area, including how we deliver together more joined-up care and more person-centred care for our local populations. So the attached discussion document brings together months of work that we've been doing together to first of all assess the health needs of South West London's populations, and I'll come back to how we've done that, to bring together the priorities that arise from that, and then to recommend to the board some priorities that we want to begin to work on together. But really important that we work in partnership with South West London organisations, and it's really important that we do what they need, and therefore rather than produce a strategy, what we discussed as a board was to produce a discussion document, hence the conversation today, with the intention of producing a full strategy in the summer of this year coming. If you wouldn't mind going on, please, Maureen. So the assessing needs was a group that was set up as advised by the board a few months ago, made up of a cross-section of South West London partners, looked at a huge amount of information, including the local joint strategic needs assessments and local health and care plans. And in the document and on this slide, there is a link to the full needs assessment. It's a really, really good and thorough piece of work. I'd advise people to look at that if that's something they're particularly interested in. But it's really difficult equally to summarise all of those things in such a short discussion document. So in order to give the work justice, please find that attached and look at that at your leisure. We also looked, if you wouldn't mind going on one please, Maureen, we also looked at what our local communities and populations were telling us. And again, within the discussion document, you'll see this visual, which shows the priorities and the needs of people through the culmination of lots and lots of conversations that we've had, both across South West London and locally. But what's really important to the people of South West London, and that has driven a number of the things that we are recommending in the discussion document. If you move on one, please. We, as I said, also looked at the joint health and care plans to look at where the commonalities were and to look at where making a difference at scale would make the most sense. And we looked to see where there was similarities and differences in local health and care plans so that we could see where we came together. We also looked at Core 20+5, so where were the health inequalities that were existing and also the priorities that were already being identified through the Health Inequalities Board. And we've also attached in the discussion document the 6 health and care plans, and they'll also be on part of our website, just so that people can see that local needs are definitely driving what we do at South West London. But just to remind board members, the idea being that where things are best done at scale, we agree those as a partnership. Where they are best done in place, that we obviously do not get involved, and that we do not make sure that, or that we make sure rather that there's no overlap, so that we're not duplicating effort as we work together going forward. We went through a process of determining those priorities. If you wouldn't mind going on one, please, Maureen. So you'll see on this slide the stages that we've gone through in order to get to the discussion document today. In November, that culminated with a seminar with the board, and that was fed from information and views from the people panel we asked. As we saw 10 priorities emerge from the health needs analysis, we asked board members and also the people's panel to identify the priorities for them that arose out of those. And you'll see the grid at the bottom and in the discussion document just shows how people rated those priorities. Would you mind just going on one, please? And therefore, the seminar brought together a range of things that the board felt that should be worked on across South West London. And these are obviously in the discussion document, but just to pull them out. So preventing ill health, promoting self-care and supporting people to manage their long-term conditions, to support the health and care needs of children and young people, to target mental health, and community-based support for old and frail people. But within there was some really strong and important cross-cutting themes that when we talked to partners were felt that actually they should be going across everything that we do. And they are equality, diversity and inclusion, that we champion in everything we do, the green agenda, that together we tackle and reduce health inequalities in the actions that we take, and that we elevate patient, carers and community voices through the work that we will do. We also had a very strong theme that came out of the conversations with the board around workforce. So in order to achieve everything that we need to do as a partnership and in all the organisations that form South West London, workforce came through as a strong theme for things that we should do together. So the recommendation in the discussion document is to work on workforce together, and actually 4 work programmes emerge from that. The first is that we work together to make South West London a great place to work, so that we not only retain the staff that we have, the very experienced staff that we have, but also that we become a magnet for people that want to come to a great place to work, and that would be South West London. That we obviously have challenges today in some of our staffing, so we have roles that across our organisations are very difficult to recruit to, and therefore the second theme in workforce would be to target action around some specific roles that are proving across health and care to be very difficult to recruit to, where actually system work and system insight may be helpful. The third is to design the workforce of the future. So obviously we've got today's challenges to work on together. We've also got changing needs as we move forward. So if we vision forward 5 to 10 years, what are the kind of different roles that we might need in health and care as we go forward, and work on some of those together. And then finally, under this part, to support local people into employment so that we reduce health inequalities, that we support people through the cost of living crisis that many find themselves in, but also that through that we tackle poverty together. So the discussion document asks partners' views on a number of things. The first is that those recommended priorities that I've just gone through, whether they are right, and whether partner organisations would want any specific actions built into our future delivery of those. Whether the 4 proposed workforce programmes are right, and particularly the key workforce challenges that each of the organisations are facing that actually coming together on would be helpful. For example, different roles that people might think they have, particularly difficult recruit to roles that maybe be experienced in organisations. And then finally, any other areas that they think that we haven't accurately captured that we need to build into the final ICP strategy. And through the discussion document, we ask that people feed back those views on the website that's described, but also by the 10th of May, so that we can come back and talk board again about the feedback we've received and shape our future work in line with that feedback. And just important to say that we recognise there's still a huge amount of work to be done, but this is just a kind of a pause to say this is where we've got to and how do we move forward together as a partnership. And so I just wanted to spend a little bit of time just talking about partner views. I suppose it's just really important that as we develop our strategic priorities, that we take the right length of time for the partnership to make sure that they are absolutely right. So the strategy and the priorities that we work on together really are fed up from the needs that we see as local organisations and local places, and that those needs and those priorities drive what we do together. We also want to make sure, and I think this came through when we were first creating the ICP, and we were talking to people about this particular board, and a number of you and others fed back that actually what we wanted to make sure is that we took action and we made a real difference for our local populations. And therefore we want to make sure that through the strategy we can achieve things together. So importantly, that as we look at investment going forward, that the investment is targeted on delivering the priorities that we together set. Following the board meeting, we will write to all the board members, we'll write to all organisations with the discussion document and the asks that we have in terms of sharing the document within their organisations and in partnerships and feeding back to us on the things that are proposed. And we'll also produce some materials to make sure that that's easy for leads to be able to do by the 10th of March. And then finally on this slide, the only thing to say is if for any reason there are really important meetings that are happening outside of those, obviously we want to see those as well. So to let Charlotte and I know if there are any meetings that fall outside of the 10th of March that actually people think we should wait for. And then if we just move on to the other slide, just in terms of a word on engagement, Charlotte, do you want to just...
Yep, so just quickly to recap our phased approach to engagement, which we've talked about before. So you can see shaded out, we've completed phase 1 and phase 2. So that was just to remind you, the community insight that fed into the needs assessment. And then that deeper analysis we did in phase 2 of over 120 engagement reports from across South West London, from health and care organisations, so health watches, our voluntary sector, as well as the statutory organisations, to give us that snapshot that Karen talked about just now in the overview, and as well as kind of shaping our emerging priorities in this group and with key partners across South West London, as well as the South West London People's Panel. So we're now in phase 3, and where obviously depending on the approval of this final version of the discussion document, we'll be engaging partner organisations and system leaders, as well as patient and community representatives to consider the discussion document. But also in parallel, we'll be thinking about considering the joint forward plan for the NHS engagement from April. And then phase 4, those 4 priorities that Karen talked about, it's about really reaching deep into our communities and doing some strong community engagement with those communities, especially those that experience health inequalities. So for example, Karen talked about that 4th priority about getting local people into employment. So really reaching into communities and talking to people around employment in health and care organisations and the kind of motivators and blockers, and really understanding and getting into our communities and talking to them about careers in the NHS and in local care. And I suppose sharing the examples of good practice that we know from our seminars are happening around the patch. So that's just a quick snapshot of the engagement sort of going forward until June 2023.
Thank you, Charlotte. This last slide, well, the second to last slide, just says thank you. To get to the point that we are today has taken a huge amount of work so far. So for everyone that was involved in assessing the needs, people that looked at the information and brought together and helped us shape the priorities, thank you from the health needs, and also for all partners that have been involved in the seminars and the sessions that we've had so far to get us to this point. Obviously, we've never done this as a partnership before, so important to take stock and to take a breath and make sure it actually reflects what we all think that we need to do together. And then finally, I would ask the board to note the work that has been undertaken so far to develop this first stage of the integrated care strategy, to review the discussion document and to support us to go and seek partner members' view on the priorities that are proposed within it. Thank you.
Thank you very much for that. So before we move on to the recommendations, I'm going to open it up to the partnership for discussion and comment. Gillian.
Thank you very much indeed. I do want to start by saying what an excellent document I think this is, and I think it's a really, really good quality piece of work, so thank you to everybody who's worked so hard on it. Absolutely support the four main priorities. I wanted to make a point in relation to prevention of ill health and supporting the health and care needs of children. It's very apparent to me as I go around my hospitals the amount of lack of understanding of conditions that people have, and the failure to recognise that things they've done in their lives have directly contributed to the situation they find themselves in. It has a very, it's very impactful in a vascular ward actually, in particular, but I could go through many. And the failure of people to understand, I think because it's not often talked about, but smoking is as damaging to your arteries as it is to your lungs. And so I wondered if we could, in terms of the detail, just pay attention to trying to get education built, particularly for young people. It may be too late with some of us oldies, but particularly young people better understand the realities of how to live healthily. So I just wanted to make that particular point, Karen. And then in relation to the workforce stuff, with obviously I support, because we discussed it really strongly in the seminar, the two particular ones of the four that have the most resonance with me, because I think the other two are being done reasonably well, certainly in my trust, is the workforce of the future, where we talk a lot about it but don't think we do very much, and supporting people into employment. So just personally, they are the two where I think probably the partnership can add the most value. But as I say, I want to finish where I started. I think a really, really strong piece of work, and I suspect we're in a much better position than any other ICS, because no one else I talk to seems to be anywhere close to this. So thank you.
So it's Brenda, isn't it? Brenda, yes. Brenda.
Thank you very much. I too think it's a very good piece of work. I'm very impressed with it, and I would certainly support the focus on employment and workforce for the future. The question I wanted to ask, and I think it also links with the paper that Sam is going to present shortly, is about some of the aspects around engagement. And what I was thinking about when I read this document, and indeed it may apply to others as well, but I was thinking about some of the people who are our most excluded groups, and also those who have who experience health inequalities probably much higher than some other aspects of the population. So I'm curious and interested to know how we're going to present the guts of this strategy, for example, to people with learning disabilities in particular, because obviously easy read versions are sometimes the hardest ones to produce, but I think it's so germane that we actually consider this. And I'm sure people with learning disabilities are included in some of the engagement work, but I'm thinking particularly of some of the outcomes from those people, for those individuals, in terms of their health outcomes, the morbidity and also the greater, the reduced life expectancy that affects them. So just curious about those aspects, but I think it's a really good piece of work, so thank you.
So I think that's a really good point. Can I actually ask Charlotte? Charlotte, could you come back on that?
Yeah, really, really helpful point, actually. Maybe we talk afterwards about how we do it. I mean, Steve and I were actually talking yesterday, weren't we? And we were talking about how we engage, particularly communities who experience health inequalities and different groups of people, including people with learning disabilities. And Steve made the brilliant point, and Steve is our voluntary sector representative. Oh, that's good. That we shouldn't shy away from having strategic discussions with different groups. So I think we'll definitely take that on board. And I think particularly once the discussion document is approved, and then from March, engaging on those 4 priorities will be really important, and particularly I think the 2 that Gillian mentioned, because I think local people particularly can tell us what we need to be doing. So I think we really will co-design particularly those workforce priorities and how we do it, and actually with our staff as well. So I think that kind of co-design piece, we have some time to get that right. So we'll be discussing the strategic priorities, and then from March we'll be delivering them. So I think we've got time to kind of work together and figure out how we do it right and how we make it a success.
Okay, I've now got 3 people. I've got Dino, Steve and Peter. So we'll take all of those questions and then come back from the team. Dino.
Thank you. Comment from me. I too wanted to express how clear and excellent really the document is. It accurately, for me, brings out all of the priorities and the themes that we've discussed through conversations, through the workshop that we collectively held together. I think the visual on that you've showed on one of these pages here is absolutely fantastic. It also shows the new areas that have been added, which I think are really keen, and I would too support the focus on, particularly on employment in terms of our future workforce, and that will obviously help for the sustainability of the system. So I think that's a really key area. So I think the document is excellent in terms of describing the why and the what. I think going forward, how we implement, I think, is going to be a key area for us to determine, and how we can implement in a way that genuinely adds value to the work that's being done at place and neighbourhood level. Interestingly, some of the strategies in the next document on the social care workforce strategy might help us with some of the how. But overall, just want to really compliment yourself on the work that's done so far.
Thank you, Dino. Thank you, Steve.
Sorry for being late.
That's okay.
So like Gillian, I was looking at designing the future workforce and the employment, and I think there's a link across those with the point I want to make. The whole system, as you know, is expanding into things as grassroots and local as mutual aid and the food banks, the volunteer runs, the befriending schemes, all of which I know Yvette will support me in saying kicked into 3rd or 4th gear during the pandemic. And what has come out of that in Croydon in terms of a delivery arm is the community hub model with a lot more to it. What we're trying to do in Croydon is really bridge the work of multidisciplinary teams with what small preventative grassroots groups are doing. And the way we've done that is through posts that we're currently calling community facilitators. Not a very sexy title, but I think this is something that we can really look at in terms of training and the sorts of roles that we, if we're looking at employment within communities. We've got health champions, community connectors, various labels again being applied to the kind of people from within communities who are bridging that gap and finding ways of turning personalised care into something real for local people. So I'd like to think that there is a part of the workforce that we can develop that makes community hubs really deliver on all of the priorities for the plan. Thank you.
Thank you very much. I've got a few people with their hands up. I'm sure that working with the voluntary sector and local groups is going to be key to our delivery of a lot of this, not just not just on workforce, but on all of the priorities that we have as a partnership. I'm absolutely certain of that. I've got Peter, Carolyn and Shannon. We'll go that way and then we'll get the team to come back. Peter, thank you.
Thank you. One of the top priorities in Merton is tackling health inequalities, and when I started to read through that document, this document, I saw very early on in the introduction the 3rd bullet point was reduce health inequalities, that we're all committed to that. That's great, and we've had lots and lots of discussions about that. and then it's mentioned again on page 5. But when we talk about the priorities, there are 4 bullet points in the boxes, and then health and a cross-cutting is, all of our priorities are underpinned by this. And I've just got this worry that if tackling health inequalities isn't in that box, then it won't be seen as the priority that I thought we'd all agreed it was, and certainly needs to be, because when you look at life expectancy and many people have talked about some of the issues. If you're talking about smoking, for example, look at the demographics of smoking and inequalities, and so I would like to see that front and centre, and it is in the forward, and it just doesn't seem quite right to be not in there as well.
Well, I think if the partnership agree that we should move that into the top box, I think that we can do that. I don't think that is, unless anybody disagrees with that. I mean, I think everyone's agreed that reducing health inequalities, we could have them both boxes, would be my view, is a cross-cutting, and we could have specific work streams. So we could put the inequalities, we could look at the wording and put something along those lines. Iona and John want to come in on that point, yes? So, John, then Iona.
So while I don't disagree, I suppose for me the best way we can tackle health inequalities is through preventing ill health, promotion, long-term condition management. So it's about the actions through those which are more likely, in my view, to reduce some of the health inequalities, whether it's physical health, whether it's mental health, whether it affects certain cohorts of people, whether it's children and young people, as you mentioned. So for me, reducing health inequalities is a theme, but every section of society has some type of health inequality. So I just wonder, I like it, I'm happy to see that change, but I do not want to see anything that dilutes the prevention of ill health, long-term condition management, promoting self-care for me, from a public health perspective, and I'm not speaking on behalf of public health obviously, is where we really need to be making a difference, because it's what we do today that will make a difference in 10 years' time for me, and that's around those particular themes. Just my perspective on it.
Okay, we'll go to Iona.
And just to add to that, I think when we look at the areas in the top box, the actual work that will be done will implicitly reduce inequalities. So I don't think, just because it's not mentioned there, I like the cross-cutting themes, because I think the other bullet points in the red box are also very important. And my worry is if we lift one up, does that mean all the other 3 are less important too? So I think it's on us, when we're delivering this strategy, that we keep those golden threads in the bottom box across all of the themes in the top box. And I think that will be the way we should be delivering it. So, not to disagree with equalities being hugely important, but I think the way it's presented actually reflects the essence of the work we'll be doing.
Hey, Graham.
Thank you. Yes, I mean, I do have sympathy with what Peter is saying, and I think the real issue, I mean, clearly we're not going to disagree that preventing ill health, promoting self-care, etc., is important. That is very much a specific health objective. And I think that where people like Peter and myself are coming from in terms of health inequalities, and Peter can obviously comment on this, is that we would actually like to see tackling and the ICS as a whole, as a complete strategy, tackling the social and economic determinants of health inequalities and how we actually sort of link into that process. So you can either see this as, shall we say, primarily or entirely a health-based approach, which is essentially embodied in the top of 4 priorities, or whether we will, as an organisation, try to look at those broader socio-economic factors which impinge upon health inequalities. So I would certainly broadly support Peter. Thank you.
So I wonder, so I was just trying to think about how we could do this. So when we do the final strategy, one of the options that we have is to make sure that we have a real focus on health inequalities, Peter. So what we could do is get very specific then about what change and where, because in the next few months, one of the things that we're going to have to do, because remember this is just the high-level document, isn't it? So maybe when we get to the next level and we agree, so when we say reducing health inequalities in children and young people, exactly what is the partnership going to do about that? And maybe pulling those out might give us much more information about the exact targets that we're beginning to work on together. There's an opportunity to flip those boxes around as well. So at the moment we talk about the ones, the targeting and prevention, etc. first. We could flip those boxes around in the discussion document so that targeting health inequalities is one of those things that comes first rather than further down the line. I don't know whether it's presentational or whether actually we should do more when we get to the final strategy, which has much more detail about health inequalities and what we'll actually do.
Okay, let's. Gloria would also like to come in on this point. I have got Karen to come in, but I think it was on a different point. So, Gloria.
Yes, I just want to say thank you to all, and thank you, Peter. I think the point you raise is really crucial, and I just want to find out why can't we put health inequalities as the fifth thing? And what I want to say as well is that I totally agree. There is the importance of looking at prevention and early intervention, which will prevent the future. But health inequalities is quite different. It's not the same. Prevention and early intervention will look at the total population, and that's why we are looking at population health management. But health inequality is a different concept. These are people that are actually suffering from the gaps that we see in terms of care being given to them. So it's quite different.
So I'm going to make a suggestion, because I think what we are all agreeing is that health inequalities is a high priority for all of us, and that needs to be reflected. I'm going to suggest we put it in both boxes, and we try and put the wording in a way in which describes the difference between it being a priority and it being a cross-cutting theme, and then we make sure when we do the full document that the real priority around how we're going to do that, it really comes through strongly, and hopefully people would be happy with that, and we'll just think about how we describe that. Is that okay? Thank you very much. Caroline, can I bring you in on I think you had another point.
Thank you, yes. And one of the amazing things that has been achieved in this document is trying to boil down into priorities, such a vast amount of system change. So my point is more about the focus for the year on workforce. So a bit more specific, I'm really, really pleased that Sam's here to present the social care workforce strategy, and I just want to make sure that we take every opportunity to integrate the two plans so that we're using our resources in the best possible way and taking a step further towards integration. And I'm really looking forward, as we develop it, to developing a series of actions that will have measurable outcomes. So I think it's absolutely fantastic piece of work to get to this stage. Really support this as the focus for the year and the themes that are in here, and very much look forward to developing them further and to working closely with the social care programme.
Thank you very much. I'm going to come to Sukhvinder, and then I'm going to come back to the team, and we're going to see if we agree Shannon, I forgot Shannon. I'm so sorry. Shannon first, then Sukhvinder. See, I did write it down, Shannon, I just didn't do it. That's always the way.
That's absolutely fine. Mine was a comment, really, and whilst I agree with everyone else that workforce is a really good starting point just because of the immediacy of the issues around that, I think we also need to acknowledge the fact that some of the health challenges that affect our population also affect our workforce, and that contributes, in the lost productivity and some of the attrition, actually, of the workforce that we're trying to retain. So I just wanted to comment on the fact that I hope that the retention work stream of the workforce that work stream will also look at how we can support the health of our existing staff, especially given that one of the strands for future to address in the future and the strategies around preventing ill health and promoting self-care, I think that affects our staff, our workforce as well.
Shannon, I think that's a really good point, and we are, I'm sure, the largest employers, health and care across South West London, I'm sure we are. So I think that's really important. Sukhvinder.
Thank you. Like others, I really commend the document. I think it's been well produced, very clear, and very logical in the way that it flows as well. So that's good. My point might kick over into the next bit, which is really to do with the priorities that have been identified, because if we're talking about a focus for the first year, there's a lot there in the 4 priorities, and I would like to be quite clear what success looks like for us, and it might be that success is more tangible or more easier to define in 1 or 2 of those areas than all of them. But I think, especially when it comes to some of the communities and parts of our population that have been underserved and suffer from health inequalities, if you don't meet the expectations that you set out for them, then you're going to lose we're going to lose the confidence and the trust with them. So I think just being clear about what are we hoping to achieve on behalf of the communities, and then show that we can actually do that.
Thank you very much. I'll get the team to come back on that, because I think that's an important point. I did say you were the last one, but Yemisi has come along, and it's her first meeting, and I think if you introduce yourself, Yemisi, and then...
Good evening, everybody. Yemisi Gibbons. I'm the new chair of Croydon University Hospital, Croydon Health Services. Thank you. The one point I wanted to make, I think it's a really good starting point with the strategy, and having looked through it and the fact that we are looking to serve our community, I don't see the word co-production in this at all. So I think that is so important. We're talking about health inequalities, we're talking about prevention. I think it's really important that actually this is done with our communities in terms of engagement and in terms of co-production. Thank you.
Thank you. I'm going to get Charlotte and Karen to come back in, and then I'm just going to round us up. We can look at the recommendations, and then we'll move on to the next item. Thank you.
Do you want to do the co-production bit first, and I can pick up?
Yeah, so very good point about co-production. It is actually in that big slide that's very colourful about community feedback, because that is one of the things we've heard loud and clear from our communities, which is please design services with us, not for us. So I think co-production is at the heart of what we're doing, and we have a communications and engagement strategy for South West London, which we kind of iterated over the past year, and one of the key values in that is around we should really be co-producing. And I think this kind of partnership we've got now and the opportunity with this document will really be, a good test of making sure that we do that, particularly with the workforce issue. So probably need to emphasise it more in the document, I think, and that's a helpful feedback, but it's definitely one of the values which we're going to definitely deploy.
Thank you. Karen.
So if I just summarise some of the other things that we've heard, then obviously we'll change the recommended priorities in line with the conversation that we've just had. I think if I think about what Dino has said and what others have said about how we implement and how we get to the real things that we're going to do and then how we're going to measure that. One of the things that we want to do is we'll begin to work, if the board agree that these are the things that we want to go and talk about, we also now need to go and just explore what do we mean by action under each of these areas. So there are established ICP groups that will help us do that, and experts around South West London that will help us do that. Because one of the messages very loud and clear, again, when we were creating the ICP was, let's do a small number of things really well, rather than try and do everything. So one of the really important roles that we'll have as we go forward as a board is to determine exactly what those small number of actions are that are actually going to make the biggest difference, and then how we're going to measure the impact that they make for our populations. Just in relation to workforce, there was some, I think it was Stephen that talked about some of the great roles that are out there and some of the good practice that really exists in South West London. And Carolyn and Andrew and Guy, we met recently to talk about potentially a workforce summit where we begin to, if workforce is our biggest issue, then how do we get beneath what everybody needs? So obviously the feedback from partners through the discussion document is going to be really important. There will still be an element of work that needs to happen after that. So potentially bringing cross-section of both staff, so that, Shannon, your point about retention, we need to make sure that we're taking the actions that staff need and want us to take rather than actions that we think people need from us. so to bring in staff and organisations to help us just get to a point of beneath to say, well, how do we then take this together? But the good practice that exists across South West London is one of the things that we're going to have to bring together and share, as well as starting some of those new things from scratch.
Thank you very much. So, on that basis, are we happy as a partnership to support this discussion document, remembering there is a next phase to this where we agree the finalised strategy and the work plan behind it, to go forward with the amendments that we've discussed and agreed? Is everyone happy? Yes, thank you very much, everyone, and thank you to the teams for all the hard work. And that's not just the team here, but the teams from Public Health and others that have been involved, and comms and engagement, and everybody in local places been involved in the development of this. So now we're moving on to the next item. Now, because workforce we have already identified as an area that we want to focus on, I think it was clear that we're not starting from a standing start on the work that we do on workforce. And so we thought it would be very helpful for the partnership to hear about some of the work that's already happening. And so Sam's agreed very kindly to come along and talk to us about the social care work that's going on. But also, I was just going to say, well, you do to have NHS work that's going on. And what we are looking to do is maybe join all of this together into a single way of working across the system, which is what we're all about. But we thought there's some really good work already going on. So over to you, Sam.
Thank you, Sarah. As Sarah said, the purpose of this item is to give you an overview of the South West London Social Care Workforce Development Strategy that the 6 boroughs have developed, so it can feed into the work that we've all just been talking about in terms of the integrated care strategy and the priority on workforce. Hopefully you've got my slides in your pack, and I'll just pull out a few key points on those. So, again, as I'm sure you're all aware, there are substantial challenges around recruiting and retaining a skilled and sufficient social care workforce in South West London. As we know, it's not just a South West London issue, it's also a national issue, but it does seem perhaps slightly more acute in South West London, perhaps associated with the challenges of the higher costs of living and competition from other sectors. In response to the challenge, the South West London boroughs at the end of 2021, early 2022, decided that they would develop a social care workforce development strategy. And the purpose of that strategy was to identify what collaborative action would help address that challenge. We commissioned Sky to work with us to develop that strategy, so the Social Care Institute of Excellence and Skills for Care also worked with them on that. The strategy was published just before Christmas and is available on the SLP website, and hopefully you've got the link to that. And again, we haven't got the slides on the screen, but hopefully you've got them in front of you. I think it's just helpful just to pick out some of those key features of the social care workforce in South West London. And again, as we've said, there are 36,000 jobs in social care in South West London. It's the 3rd biggest employer. The majority of those jobs are in the independent sector, in small providers. The majority of those jobs are also direct care workers. So that's the workforce that we're largely focusing on. It's also an ageing workforce. It's predominantly female and a high proportion from Black, Asian and minority groups as well. In terms of the challenges, very familiar. High level of turnover and vacancies. Around 40% of people leave their job in the first year of being in a job in social care. There's also increasing demand as we've got an ageing population, and also in the context of the future workforce and the new models of care that we've that we've referred to. So, a whole load of challenges, which I'm not going to go through them all because you're in your pack and you'll be quite familiar with them in terms of the social care workforce nationally, but in particular as well, very acute in South West London. So in terms of the strategy, I suppose what it identified was that there's lots of good work going on already. So there's lots of good work within local authorities, across training, education providers, by employers themselves, employment support, but really it's probably not at a sufficient scale to address the scale of the challenge, and it's not that joined up both locally and at South West London level. So that was kind of some of the main feedback. There's also, you know, and the opportunities from some of that join, well, the opportunities from that join up, particularly between, you know, prospective employers, existing employers, training, education, skills providers, those organisations and partners who provide employment support, that there's considerable potential to have a bigger impact by helping those organisations work together more. So the strategy then, you know, it arrived at, there's around 12 recommendations, and again, they're detailed in the pack. There are recommendations within the recommendations, so they are quite detailed. They are intended to cover a period over the next 2 to 3 years, so you know, taking us towards the end of 2025. A couple of them are slightly more longer term, but just again, just to highlight a few of the pertinent ones. In particular, a recommendation about actually creating the right infrastructure to support the delivery of the strategy. So bringing together a partnership board, and we actually had the first meeting of the Social Care Partnership Board today, which was great and went down really well, and lots of really good ideas from all the partners. But then, you know, a key piece of work around promoting jobs and career opportunities and entry routes into social care. So very much focusing on raising the profile. So I think that was a key one. And then again, a big focus around retention and the existing workforce. So sometimes we spend quite a lot of time talking about attracting new people into the workforce, which is really key, but also we need to focus on the existing workforce and supporting that workforce to develop and progress careers through social care, but also into other sectors, including health and the NHS. So I think I'll leave it there. A quick summary. You've got the details, so thank you.
Thank you very much. And I'm sure actually looking at this, there is a huge amount that we could do together across health and care that we could actually get added benefit from. Sukhvinder.
Sam, thank you for that. It's very, very welcome. Isn't it great to see this presented like this? So thank you for that. But can I just ask a clarification? So the Health Hub, which is so I'm just trying to get a sense of how this connects with the South West London Health Hub, which is also about AHPs and nursing and midwifery as well. So will we get comparable programmes coming through to address the other professions?
Thank you. That's a useful reminder, because I did forget to mention the Social Care Hub. So we've just been awarded funding from the GLA for a social care academy hub in South West London as well. So that is the parallel hub to the health hub in South West London. It will be hosted in SLP, but we were very clear in the bid and the proposal that we expect to work in a very integrated way with the South West London Health Hub and do a lot of things together, and potentially once the initial funding from the GLA finishes in a couple of years' time, we may be able to have an integrated hub. So that was the broader ambition. And that hub, well, both hubs will allow us to deliver quite a few of the things in the strategy. So we do, you know, want and expect to work very close, the two hubs to work very closely together. Thank you.
Peter.
I was interested in recommendation 7, because I think this is really important. You know, what we're talking about is the value and reward for people working in social care. So the obvious question is, have you been discussing the payment of the London living wage, because, you know, talk is cheap, but actually we need to take some action. And you know, before anyone asks, well, what are you doing? When we retender our domiciliary care contracts, and it's coming very shortly, we've made the decision that we are going to insist that people pay the London living wage, and that's something that will spread throughout there. And we'll only start to show people that we value them if we pay them. And, you know, I'm constantly reminded of the struggles that people are experiencing right now with, you know, heating their homes and, you know, making that awful choice. And having principles costs money, but I think we should be adopting a principled approach. And surely the time has come for us to not just talk, but do.
So Peter, I think we have in the NHS committed to the London living wage in all of our organisations. So obviously we support that in the NHS. This could be something that could be picked up through the workforce stream, would be my view, and I think we as a partnership, if we could sign up to that as a principle, obviously all the partners need to be able to sign up to that, but that would be something quite significant, I think, for the partnership to commit to. I'm not going to ask people to commit tonight because I don't think that's the fair thing to do, because I think there needs to be further discussion, but definitely from the NHS I think we'd be willing to commit to that. I think it requires further discussion outside, but ought to be something that we should work towards, would be my view.
Sarah, I think you will have seen that this is an invitation to join us, and
Yes.
I hope that people will accept the invitation.
Thank you. John?
It's just a question relating to the Workforce Board itself. Co-production with Workforce gets mentioned in Priority 4. Will there be members of the workforce actually on the strategic board? And the reason I ask that is my aunt resides now in a nursing home in this local area, and the description of the workforce in this data is exactly as I see it when I went to visit her last night. And I'd like to think particularly those women will have a voice and a representation at that strategic board, because otherwise, dare I say it will be us be talking about their needs as opposed to them informing us about some of their needs and their experiences. So it's just an observation, and what is a very positive direction of travel.
And just quickly on that, at the moment we don't have the workforce on that board. We do have, there are quite a few employers on that board, but what we're also trying to do is build the engagement and the way of working on what happens locally in boroughs. And so boroughs have quite extensive carer and service user forums and also employer provider forums, and we're trying to use those networks as well as creating a small level of new ones as well.
No, I do appreciate that, but I'm
Yeah.
specifically about the employees, because they are the people
Yeah.
that we've talked about in terms of pay and conditions. So, you know, we all invested in this, and I just want to take the liberty of speaking on their behalf at this place.
No, thank you, and certainly, you know, take it forward.
Okay, Charlotte?
Yeah, I suppose just to offer the support of the NHS communications and engagement community. So I think we recognise that this is really important for all our system, and I think we've shown the power of local authorities and NHS communications people working together during the pandemic, during our vaccine campaign. So I think, and I've talked to provider NHS Trust colleagues about it this week, so to offer support and kind of sharing your content and messages through our many channels of the NHS.
I'm going to go to Alyssa, and then yourself, and then we're going to stop because we're over time now. Alyssa, I will come back.
Thank you. I just wanted to ask if the strategic board will also be considering the training and psychosocial needs of unpaid carers, those informal workers who are supporting family members. Thank you.
Thank you very much. I think that's very important. Annette.
Thank you. I just would like to say that all the DASs across South West London have really signed up to this around the workforce, and there's many people that are on zero contracted hours within social care, and it's the terms and conditions of the way that people are working, and it's very important then while we're considering the way we commission
services across health and social care. And quite often where pots of money comes out on funding and it's all quick turnaround, we've got to commit to ensuring the conditions for people that are working in social care and health are good. And there is a career pathway for those individuals. And I would say, as a member of the DAS group across South West London, the commitment for this workforce group is really powerful, and I think it would be a good thing to join up. Much better to work together.
Thank you very much. So thank you very much. I think we look forward to seeing the next iteration when we start to join all of that up and we think about our future commitments as a partnership. So I think we will be talking in future meetings about workforce quite a lot, because that is one of our main priorities, and we will be having discussions outside as well. And thank you very much, Sam, for bringing that here. It's been very interesting, I think, for us to see the work that's going on and the commitment, I think, from social care for that. Right, just moving us on now to the Innovations Fund, which I'm sure everyone's interested in.
Thank you. So first of all, just to say that Angela Flaherty, that did a lot of the work around the Innovation Fund, is in the audience with us today, and I just want to say thank you very much, Angela, for all the work that you did, because I know that it was challenging at times, wasn't it? Because it was the first time we did it. But just to remind the board, in October, we agreed to put together an innovation fund. It was out of top sliced NHS funding, just under £5 million we opened up. First time the partnership has done something like this, and what we agreed is that it would be focused on sustainability and winter resilience, given the fact that we were about to go into a quite tricky winter, and we're in the middle of it now, aren't we? So we had a rapid approach to year one, and you'll see in the pack or in the paper, £2.7 million worth of funding has been released to schemes to innovate during that time. I won't go into the detail of them, but you do have all of those in your pack. But we also recognised that it was new and it was fast and it was difficult for people because of that. But we did want to get as much funding out into the system as we could. So we also met with every organisation that bid, so that we could learn from their experiences, the things that went well and the things that we wanted to do differently. We also asked members of the various panels that we put together through the process for their views, and what you also have therefore in the paper is a recommended process should further funding become available as we move through different years, to listen to the feedback that we heard and improve the process as we go forward. Understanding that as we move forward, the Innovation Fund, wanting to make sure that that's focused on ICP strategic priorities and delivering those, as I mentioned a little while ago. So I'll stop there. I assume everybody's read it, just in the interests of time, Sarah. Happy to answer any
And can I say we did a big workshop where we got the feedback from everyone involved and those that were bidders to get their feedback in order to inform the process, and it was I know because I was there, it was a very good meeting and people were really engaged in the process. So we recognise that this was done very quickly this year. We will move on to the inequalities, which is the other half of this fund, but it's split into two parts of the fund. Any questions or comments? Yes, Sukhvinder.
As a previous funder, I know how hard it is to spend this much money so quickly. So I know it was done very fast, and so well done for doing that. I did pick up a little bit of criticism from some of the voluntary groups, which I'm sure you're aware of, and in particular, I think the idea that the specific criteria that was fed back to me was about where it overlaps with what local authorities are doing, and some of the community groups think they're doing things that local authorities aren't providing, and I so I just wonder whether there's managing expectations around that. But the main point I wanted to make was, with all these fabulous groups now, what's the sort of knowledge exchange and way of connecting them or learning between them as well as from them that you're going to take forward?
Thank you. So we will do exactly that. The idea being that a lot of these innovations would actually be, although they may be place focus, actually would be relevant across. So we will share that. We will learn and we'll evaluate, and we will share that good practice across. I think in future years, I haven't heard the point that the voluntary sector have made about local authorities, so I'll just talk to you separately about that. But what we will try and do in the new revised process is to have a couple of forums along the way so that actually we can help people talk to each other about good ideas and so that we can share across places and others some of the things that maybe have happened before that have been successful. So we will put in more conversations and more support for organisations as we go through the new process. And we will definitely share out the good practice and the learning as we go forward.
Steve.
Thank you. Okay, great process, but I'm supporting the revised process. And when it comes to consulting on it, I should point out that there's investment now in the South West London Voluntary Sector Alliance. We're going to link it into all the networks and forums that we can locally, so you've got a ready-made vehicle there. A point which sort of comes to the one made previously. I mean, I think by definition, innovation, we're looking for projects which perhaps are about systems change, do things differently. The problem with these sorts of funds, though, is that we never build evaluation from the start. We need to be able to evidence that we're actually, you know, not just being innovative, but delivering and achieving on the outcomes. So perhaps that can be given some thought as to how we, you know, because we always look for mainstream funding after getting innovative sort of funding to pilot things and start them off. But it's the sustainability which is the challenge.
It's a great point. It was one of the things that we actually asked. So I think my message would be we are doing that, but we're not there yet, I think. We did ask bidders to identify the outcomes and the impact that their schemes would make. I think people struggle with that. And so I think we're going to have to spend some time helping people to establish that as we move forward. But we will build in evaluation, but we haven't got that process completely pegged down just yet.
Charlotte.
Yeah, so just to support our South West London Voluntary Alliance, you know, really important that we have that evaluation. But I think, yes, because so we can prove that it's worked. But I think the cultural kind of significance of the NHS, even going through the bidding process, which we had a lot of senior leadership in the NHS looking at all the different ideas and the innovation, I think really made us think differently in the NHS about the potential of the voluntary sector and how we really can do things differently. So I think that links in with your evaluation point, because we need to use that to demonstrate to the wider system and the NHS particularly, I think, about the real impact that working with the voluntary sector can make. So I think that should be part of us talking about these programmes for the next year and then the following year, so we can really show that, you know, it makes a difference.
Piers.
Yeah, Karen, you mentioned if there was future innovation funding, and I guess the thing is that if it doesn't come from NHSE, would South West London's have a fund and so on, if not at the same scale, but to carry on this type of thinking and work?
So firstly, I need to tell you this is the South West London Fund. This did not come from NHSE. We took it from our South West London NHS budget. Nobody else has done that, as far as I'm aware, at that level, in order to fund this. This was not funded by anybody else. We set our own criteria together through the ICP through the partnership. We would like to do this again. Part of it will be making sure that we can demonstrate that what we've done this year's made a difference. I think that will be key. And number two, obviously finances are very tight, but I think we should try and recreate this again next year. We did actually, against all the odds, manage to save this money for this, even though we are all struggling financially, because we prioritised it and thought it was really important. So just so you know that it wasn't NHSC, it was our funding. So yeah, Iona.
Thank you, and I think doing the evaluation with local authority colleagues, I think working together on these things really is where we'll get the biggest benefit. And ideally, I know it's hard year on year, but over a slightly longer time period. I know this was very winter focused, quite understand that, but I think even a year of innovation by the time you get things off the ground, and I guess that worry, are you using the money to best effect if you're only looking at that window? So any flexibility on that would be really welcomed, I think. Query just on the figures where we've got the stakeholder feedback on what went well and then the image for the stakeholder feedback that didn't go so well. I couldn't help noticing they look exactly the same. Now, maybe the same things that were strong were also, you know, weakness for some and a strength for others. So I was particularly interested in what people did feed back, you know, the stakeholders fed back. So I just wondered if perhaps a different image should have gone in, so just so that we can look at that in the future.
There was actually some people, so the speed, actually, that was really interesting. There were a lot of people saying we need lots more time. There were other people saying, actually, it's really good to do this really quickly and manage it. There was contradictions in the room, so there were different views in the room. I actually think that does reflect the discussion. So I don't think there was clarity around the good and the bad. I think there were pluses and minuses on both sides, to be honest, Iona. That's what I heard when I was in the room anyway.
I think it actually looks like it's the same thing, so I will just check that, Iona. But actually, you're right though. When people said the communication was good, we knew what we were expecting. The form was simple, but the communication needed to be more. So there were flips on both of those. Can I make? Oh, sorry, go on.
Nicola, and then.
So I think it's quite difficult to get the scale of this right in terms of how much, in terms of funding and human resource and everything you want to spend on innovation every year, because you know, some of this is quite a lot of money for some of the organisations, and bid writing and thinking up new proposals and new ways of doing things when you're still trying to get what you were doing last year actually working, because things take a long time to embed and become efficient and really, you know, do that quality improvement cycle to tweak it a bit and get it better. So I just think it's really important that we, you know, just don't constantly, it has to be very considered how much you do each year on this and to get it right.
Thank you, I'm sure that's right. Karen?
So I think you're right. I think we also need to think about the time frame. So the point that you just made, Nicola, about actually sometimes things take more than a year to actually embed, don't they? So actually, do we fund more than 1 year as well? So we'll come back to that. I was just going to finish by saying thank you to everybody that took part. So for those people that took the time to bid and show their fantastic ideas of what they could do, for people on this group that spent their time and helped us shortlist through various stages, I'm very grateful for that. And actually, I think the process worked really well, and we were able to release funding into the system to hopefully make this winter slightly better than it would have been without that funding. So I just wanted to say thank you to everybody involved.
I pushed the wrong button. Totally in control, I know what I'm doing. Yeah, and thank you to all of those bids. I'm so excited about seeing the outcome of these, because when you look through the list, for those of you that have looked through the papers, the lists of bids, there is some really interesting work going on with our communities, and I just think this is a real opportunity for us. So thank you to everyone involved. It's been and I'm sure we're going to do this again, however we do it. So you know, we'll work that through together. So thank you very much. Now another set of funding. So Gloria, you're going to talk to us about the Inequalities Fund.
Thank you. And I just want to say that even the discussion we had earlier on shows how committed we are across the system in tackling health inequalities. And I just want to say thank you. And just to say, COVID pandemic actually shined a lot of light in terms of some of the hidden health inequalities that's been going on across the country. And first time ever, we had health inequalities funds separated this time around to focus on issue around that. So we received money from NHSE, so that's the difference. We received money from NHSE regarding health inequalities last year. And they were very clear in terms of what the deliverables were. However, what we did in Southwest London was not just to look at health. We want to make sure that actually we include care, health, and we include care, and also local authority, public health into what we did. And the way we did that, we were really clear in terms of the criteria. But what we don't want to do is actually continue to do what we used to do in the past. We get money and we divide it across the system, and we don't really sort of like meet the needs of that local population. So we decided that we're going to probably develop an approach or a model to help us deal with that, itself actually reducing our inequalities of funding. So we decided to use what we call health needs approach. So there are criteria, and we look at models across the whole country, and we come up with a model that we think will actually meet the needs of the funding in a very short space of time. And as you can see, in total, we had about 54 bids approved at the end of the day. The bids, the approved bid came from various organizations. We were very clear that delivery of health inequalities will not happen at just Southwest London level. We know that will happen more efficiently at place level. So our focus was to focus on place delivery. And that's why the majority of the money actually and the allocation was concentrated at place. We are also clear that we don't just want everybody applying for the money without having that ownership of it. So we did the bid, anybody can apply at place level, but we actually make sure that the place-based executive, the L2 and Wellbeing Board actually have an oversight on what is coming in, so that we can have an oversight and we can hold people to account in terms of delivery. When we talk about nationally evidence about health inequalities, the reason why we've seen slow impact and slow progress is just the ability of measuring impact and actually evaluating the impact that is making. And definitely in our bid, from the beginning, we actually wave evaluation to what we did. And now we're going to measure all the bids that have gone in. So in page 69 of the paper, we actually looked at, what we did was to learn as we go along, because we know this is a very important bid. And what we did at the end of our panel shortlisting and agreement was to look at what went well, what we need to improve on, an area to consider for the future. And that is detailed there in terms of some of the things that went well. And obviously the process wasn't perfect. The model wasn't perfect, and we are looking at working with our public health and local authority colleagues in terms of strengthening that in the next bid. And just to confirm, and I just want to have confirmed from my chief financial officer, they've confirmed that we're going to have a recurrent fund for health inequalities, but we are not sure of how much that is going to be in the new year. But what we want to make sure we've learned from this process is to start early. So we're going to probably start the next one a bit early and involve the whole system more. Thank you.
Thank you very much, Gloria. So I'm going to open it up for any questions for Gloria about the Health Inequalities Fund. Sukhvinder.
Me again, sorry.
That's okay, good.
Gloria, that's absolutely fantastic. Given that there may be an option for recurrent, well, there'll be some recurrent funding, but we don't know for how long, I wondered what your plans were for building up a longitudinal evidence base. So, you know, you talked about the evaluation. I just wondered whether you could say a little bit more about how we develop our evidence base on what works for the communities themselves.
So what we've done, we are speaking to various organizations, and we're going to commission an organization that is going to do this. We factor it in the money, and it's in the bid, it's in this paper. We have factored some money set apart for evaluation for this. So there is an organization, we're going to commission an organization that will actually look at the whole project, follow up on some of those projects. For health inequalities, it takes time to get the impact. It might be proxy impacts that we want to sort of like measure, but actually we will then follow up longitudinally in terms of how that is impacting our local population. There will be quick wins, and also some learning that we can learn earlier on that we can then think about maybe scaling up across the system. So those are some of the things we're going to be watching as we move ahead. What we want to do in terms of health inequalities, we have community connectors already. Steve actually alluded to that. We want to develop community of practice. So all the groups that are doing the project, we're going to develop community of practice so that people can learn from each other. And also we've worked with our communication department to actually create a website where we're going to put all the bids in. Again, if anybody wants to do a project in the future, that's the first place to go so that we don't duplicate. And those are the things we are guiding against in terms of the future.
Thank you very much. Any others? Steve. Oh, sorry.
Sorry, this is Democracy in Action, Chair. Apologies, Gloria. You know how much I love you, but I've been asked to put that apparently some of the funds have been a bit late in getting out. So cash flow issues. Actually, I'm told that this applies to the Innovation Fund as well, although I understand the different sources. So I don't know if anyone can just.
I'm going to come to the Chief Financial Officer to see what but, we can't blame her, I don't think, but we'll ask her what the answer is.
No, thank you. So we recognise this is the first year that we've run both of these processes. And obviously there was an enormous number of bids and individual contracts that needed to be put in place in line with the standing financial instructions of the organisation. And so that has taken us a little bit of time to work through, and I apologise for that. We are in the moment reviewing those instructions to update them as a board to make sure that they enable us to more swiftly do processes like this as we go forward, but ensure that we keep to the appropriate governance for the use of public money, and that we are following all the appropriate procurement guidelines and processes. So I can only apologise for this year, but again, we want to take the learning from this so that in future we can be much more swift about how we do these things.
I'll feed that back.
Thank you. And Gloria?
Sounds like the check's in the post.
Just to say, Steve, we are actually, there have been a lot of movements last week, and we are actually working with, especially the voluntary organizations, drafting out agreements with them. So hopefully something should be coming out from next week. So we've moved far.
Yeah, and we know that we've done this quick. We've never done this before. Let's be fair. We've never done this before. We were trying to do it quickly. We've got loads of learning. We will get the money out. We will make sure that next time we do this in a way that's simpler. I'm sure we can do that. John.
I just want to thank Gloria and her team for a huge amount of work they've done on this. But as somebody who had the privilege to review some of the bids, the really good ones were clearly based on working with communities as opposed to doing onto communities, because I think that's one of the things we tend to do in a paternalistic system. We think we know what we need to do to make them better or help their lives, and actually the really strong bids were based on working with the communities and the community leaders. So I think that's a different step and direction to what we've normally done in health there, I said. And back to the health inequalities conversation we had earlier on, it's about the practical application of how we do some of that and how we have some money to invest in it. Recurrent would be great, but that isn't always the way the money tree works, is it?
Peter.
Well, I mean, with all the difficulties, and I certainly picked them up from voluntary organisations in Merton, I think it's really important that we say thank you. It's really welcome to hear that this is going to be happening again, and it's a very important issue. And despite the, I mean, teething problems, I think is probably what we're describing here. And when you're doing something new for the first time at pace, we shouldn't be surprised that there aren't some issues, but it will be better next time.
Thank you very much. Okay, so thank you very much, everyone. Thank you to the teams, because I have done an awful lot of work. I mean, I recognise the problems, and I think we've apologised for those, and we will get better. But actually, this is a really positive piece of work, both the Health Inequalities and the Innovations Fund for South West London, and we really look forward to seeing the update on these programmes and the impact that they have had going forward. So thank you very much to the teams involved, and thank you very much for everyone that's been involved in those bidding processes. Okay, so if we are completed on that, we now move on to public questions. As a priority, we take any that we have received by email, and we have had one from Ale Gelbert. I will just check whether Ale is actually in the... Oh, there you are. Would you like to ask your question rather than me reading it out?
Yes. Thank you very much for having public meetings. It's really helpful. I do know some of you here. My name is Ale Gelbert. I'm the chair of Merton Sutton Wandsworth Local Optical Committee. So I have two questions. One is with regard to engagement. We would really appreciate to be part of your engagement. So if you, for example, include optometry, pharmacy and dentists. I did try to get engagement from your website about how to get involved in certain Merton Wandsworth, and I never got any reply. So I wonder if something you'll be able to help with that. So that's one question. And yes, the second question was that you spoke a lot about health inequalities and patients with learning disability. So we have a scheme for sighted with learning disability in Sutton. There's some issue with the contract, but that's another matter. I just wondered if you considered to expand it to the whole ICS, so it's not just a postcode lottery, everybody could benefit from that. Thank you very much.
So on the first one, I think we can definitely commit to engaging with the wider primary care teams. And what I'm going to suggest is that maybe we put you in touch with Charlotte around how you can get in touch with the communications and engagement to make sure that that is easy to do, and any feedback about that we'll take on board as well. Can I come to Karen? Because the second part, I think, is it's an NHS decision rather than an ICP decision, because that's an NHS commissioned service. So, Karen.
So yeah, Sarah's right. So it's the NHS that would commission. It's NHS England actually at the moment that commissions optometry services. So we need to talk to you a bit more about that. We've got a primary care lead called Mark Creelman that we'd like to put you in touch with and just talk a bit more and learn a bit more about the Sutton experience.
Okay. So that was the only question that we received in writing. But I am happy now, because we do have time, to take any questions from any other members of the public who have a question for the partnership. No? Okay, thank you. So then it's just for me to ask, is there any other business from any members of the board? Can I just thank everyone very much and for putting up with your interim chair for tonight. And I'm sure we all wish Ruth really well, and that she will be well enough to come back for our next meeting. So thank you very much, everyone, for your time. And we will see you all again shortly. Thank you. Thank you.